My name is John Hurst. I'm an academic chest physician here at UCL. That means I spend half my time as an NHS consultant at the Royal Free Hospital and half of my time leading a research group that are interested in COPD and in bronchiectasis. So to provide some context, COPD is a lung condition of immense global importance. Data from the WHO suggests it's going to be the third leading cause of death by 2020. And here in the UK, it's actually the commonest reason for emergency hospital admission within the UK. So within COPD, there's a real need for new treatments and to use the treatments that we have in cleverer ways and to understand more about the disease. And that's particularly true in determining why some people are prone to developing chest infections that are called exacerbations, because it's those exacerbations that are really driving the disease. And that's where this project comes in, because I think looking at imaging, in particular imaging based on computed tomography CT scans, enables us to assess some of these questions in really exciting new ways. I'm now going to pass you over to Professor Hawkes to tell you a little bit more about the technical aspects of the project.
Hello, I'm Dave Hawkes. I'm the Director of the Centre of Medical Image Computing at UCL. I'm particularly excited by this project because it involves CT scanning, and I've been working on CT scanning pretty well since its invention. What we've been able to show is that when the patient breathes in, we can take a CT scan and then we can take another CT scan when they have breathed out as much as they can. With those two CT scans together, we can see the changes in the airways in the lung. In particular, by using a technique of image registration, we are able to accurately co-align the different parts of the lung between inspiration and expiration. And that tells us how the lung is moving, how the individual structures are moving. But most importantly, through the CT scan, we can measure the density of the tissue and therefore measure how much air has moved into and out of those bits of lung. Now, what we want to do now is show, by coupling that information with a careful computational model that we're building of the airways of the lung, how the disease of COPD is progressing and how the patient is responding to therapy. And in particular, we hope to be able to follow the very distressing things that happen when one of these patients suffers from an infection, and how we can develop technology which is going to improve our assessment of that dreadful disease.
The Centre for Medical Image Computing is a leading centre applying advanced computational technology to medical imaging, and UCL Respiratory has a world-leading reputation in the translational study of respiratory disease, in particular COPD. So to end, I'm going to ask you how you can help us improve the lives of our patients with COPD by joining our team. Thank you.